amazing people. Can we just talk about STDs stroke STIs? STDs are sexually transmitted diseases, while STIs are sexually transmitted infections. STDs are caused by STIs, which are the infections itself, and this infection can be caused by microorganisms. It can be bacteria, it can be, virus, it can be parasites. We have so many STDs. We have trichomoniasis, we have chlamydia, we have HIV stroke AIDS, we have gonorrhea, we have syphilis, we have human papillomavirus, we have herpes simplex virus, we have thrush, we have a lot of them. Okay, the list continues. We have so many of them. Let's talk about the symptoms you will feel or you will experience if you have any of these STDs. But some of them don't really present symptoms. People can still have STDs without presenting any symptoms. In that case, they are asymptomatic. Why some people experience lots of symptoms. So if you experience symptoms, you might have something like sore, you might have boils, bumps, you might have boils, rashes around your genital area. This is either around your ankles or your bora or around your anal area. Okay, some people will experience painful urination whenever they want to urinate. Whenever they want to pee, they feel a lot of pain, burning sensation while urinating. Some people used to experience, abnormal, unusual discharges, maybe from their ankles or from their bora. Okay, it can be very, very offensive. It can have different colors depending on the type of STD you have. Then some people used to have abdominal pain, the lower abdominal pain. Okay, they'll feel lots of pain in the lower abdominal region. Some people used to have abnormal, offensive smell. Okay, they may have thrush coating of their mouth if it's oral thrush. Some experience loss of pain whenever they are knacking. Some experience rashes along there. Some people have fever, high grade fever, whenever they are infected. So it just depends on the type of infection you have and then the microorganism that cause it. Okay, what are the things that might increase your chances of having it? What I mean by this, the risky behaviors that might put you at high risk of having STD. One is having knacking with someone that is infected without protection, having unprotected knacking. Okay, either anal knacking or through your ecal knacking. I don't know if I could call it ecal knacking or oral knacking. Okay, this might put you at higher risk with someone that is infected. Then having multiple partners. We are knacking with so many people at the same time. You don't really know their status. That will put you at risk of having it. Then what about people that drink alcohol? People that knock under the influence of alcohol or under the influence of some drugs like recreational drugs or performance drugs. They want to praise the ladies. You will take medication that will put you at risk of engaging in some risky behaviors. That also is a problem. Then people that don't really wait, they have a new girlfriend, they have a new boyfriend, they don't want to wait and test first. You have to wait and test. So if you rush to do things whenever you meet someone new, you might put you at high risk of having it. People that share sharp objects like illegal drug addicts, people that take drugs by themselves. Sharing needle can put you at higher risk. Then mothers that are HIV positive, they don't want to take medication. They can transfer it to their baby during pregnancy or during child delivery. Then what about people that go for organ donation, people that get transfusion? So you can get some of these STDs through infected blood transfusion or even through infected equipment. So these are just the major ways you can get STDs. Okay. So with all these, you can see that there are some instances where you can get STDs without knacking. Okay, it's not just through knacking. So you can get it from blood transfusion. You can get it from mother to child when the mother is infected without treatment. You can as well get it when you share sharp object or needle with someone. You can get it if you get infected organs, maybe during organ donation. So these are just the ways you can. So what about the prevention? When we talk about preventing STDs, we know what we can do. We know it, just that we don't want to do it. We know it. Abstain. If it's possible, abstain. Don't knack. Abstain from sexual activities. Number two is that you have to knack with someone that you trusted, knack with someone that is not infected, uninfected one, someone that is free from STDs. Then always wait and test. When you have a new friend, wait and test. Wait for the test to come out before you start knacking. So you will know your status. Go for routine STD check. Know your status, okay? Go for check. The same way you go for HIV test, the same way you go for your blood group test, always go for STD test. Test for gonorrhea, syphilis, and all of them. Okay. Then you have to use condom all the time. You have to use it. We can use a condom for the protection, okay, to prevent STDs. You can use what we call dental dams for people that do oral knacking, okay. Then you can as well go for vaccination. Some of these STDs like hepatitis B and C, you can get vaccination against them. That also protects you. You can take what we call pre exposure prophylaxis. Some people that are at high risk of having STDs like HIV can take some medication to prevent them from getting it. There is a medication that is currently approved by US Food and Drug Administration. They have already approved two medications that can reduce the risk of contracting HIV to those people, to people that are at risk, people that are at risk of contracting it but they are not yet positive. So you can take this medication to reduce your risk. Circumcise your male children. Circumcision reduces STD infection by 60%. So if you circumcise a child, it reduces the chance of having